Hi, I'm Janice Marie, and we're here today in Brooklyn at the New York Urologic Institute. The doctors here provide first-class medical services to men and women suffering from a full spectrum of urologic conditions, including issues of the prostate and kidney, incontinence, impotence, and many other disorders and sicknesses. Using state-of-the-art therapeutic and diagnostic technologies, the doctors here have built a reputation on their ability to accurately diagnose these conditions, to provide you with the best treatment available anywhere. And they've gone the extra step to make your visit to their office as comfortable and efficient as possible, so you can get back to feeling good and enjoying life. Let's take a look.
The New York Urologic Institute is a comprehensive urologic center that deals with every aspect of urologic disease and urologic treatment and health. Approximately 40% of our patients are women. The scope of urologic problems that we treat range from kidney stones to urinary tract infections, especially if they're chronic in nature, to incontinence of urine, to female genital plastic surgery. In men, we deal with a wide range of problems relating to the urinary tract, including kidney stones, urinary tract infections, benign prostatic enlargement, and cancers of the kidney, bladder, and prostate. Many of these problems are very deeply personal and can be difficult to discuss, but we have a great staff that will really make patients feel very comfortable discussing whatever urologic ailments they may have.
We often talk about the doctor-patient relationship, and I think that one of the most important point of it is the complete trust. There's no good relationship without trust, and especially when we talk about urologic condition or urologic problem, something that has to be based on truth only and nothing but truth. And you have to figure the patient out after the first couple of words or sentences, and you have to realize the patients are different, and we're trying to individualize our approach to each individual patient. Somebody wants you to be few-worded. Some patients prefer you to take action and just guide them through the diagnostic and therapeutic procedure. So that's why I think we have to develop that unique relationship between ourselves and the patient, so the patient will feel comfortable and will get information that we need.
Dr. Chalek, I think he's not only a doctor, but very nice person, you know, and very important for patient to believe in doctor. But I want to tell you, not only for Dr. Chalek, I want to say about all this office. The people very friendly. He always try to help you, to make me feel comfortable, for what I really appreciate.
The nurses are wonderful, and they make him feel so comfortable, especially in a situation when someone has a problem. It is very important. So from all aspects, this is a place that I would recommend very highly to everybody.
The problems you treat in your patients are deeply personal issues. I can only imagine how your patients might feel when they walk in the door. How do you help them?
Yeah, I mean, we live in the 21st century, and you know, my grandfather was a doctor, and all he was operating was like his hands and just listening to the patient. It still remains probably the very important part of you know, patient diagnosis and therapeutic approach. But nowadays, we can't imagine the modern medicine without being state-of-the-art in the technological advances and the computerized system, electronic medical records, and that's what we're trying to implement in our practice. That's why we probably a few steps ahead of most of our college or competitors, and that's why patients like to come to New York Urologic Institute, because they know that they can get a full evaluation and fast and very effective treatment ASAP.
All the time when I come to the office, I'm impressed about staff, their professionals, their service, their attention to all of us, and it helps to fight with your medical problem with yourself.
I was very happy from the beginning from the start when I found that institute. And all staff was so good, so kind, so patient to me. I saw a warm atmosphere in that office. And when I spoke with my doctor to explain all my problems, he did excellent job, the best job how I feel now. And all treatment what I got, it was very good. It was now I feel more and more comfortable, and now I can say, if you're looking for a doctor from a urological doctor, you can go to that office. Definitely, you're supposed to go. You must go.
It's obvious you've taken a lot of steps to streamline your practice and your patient's experience here. What is the experience you want your patients to have?
Our overall goal is to make sure that the patients, one, become educated about the problems that they're experiencing and become more comfortable with their diagnosis and are treated properly and effectively so that they could return to a normal life. The diagnostic component of modern healthcare is really the most important component, and once the proper diagnosis is made, treatment is actually much simpler. And that's why the technology for diagnostics becomes critical, because 80% of the problem is diagnosing the patient correctly. Once they're diagnosed correctly, then treatment becomes much easier and much more successful. Our patients can count on accurate diagnoses that are done in a timely manner and state-of-the-art treatment options to solve their urologic ailments.
The health challenges you're facing might be painful, and certainly they're deeply personal. But as you can see, the doctors here at the New York Urologic Institute have the technology and the expertise to help. Reporting from Brooklyn, I'm Janice Marie.